Good morning, students. Welcome to Common Questions Asked in Genetics. In today's class, we will be discussing about Spina Bifida. Spina Bifida is a set of malformations of the spinal cord caused by the failure of closure of the neural tube and lack of fusion of the vertebral arches, soft tissues, and skin that cover the back. This condition is mostly seen in the fetus and infants. The lesion is usually in the lumbosacral, but sometimes it can be more extensive and may involve the entire spinal cord. In its mildest form, spina bifida occulta, the vertebral arches are absent, but there is a hairy patch of skin over the defect. The spinal cord may be normal or the filum terminale may be tethered to the subcutaneous tissue. Meningomyocele is a bulge in the lumbosacral area consisting of the meningeal spinal cord tissue. In severe cases, there is no sac at all, and neural tissue from the open neural plate lies on the dorsal surface of the fetus. Anencephaly is often accompanied by spina bifida. Okay, so here in this image, you can see how the spina bifida is looking. It is seen on the dorsal surface of the fetus where there is a bulge from the vertebral column, and there is in the bulge you can see that there is the spinal fluid, spinal cord and dura mater which is present. Okay, these are some of the problems which happen in the spina bifida. Okay, so sometimes it could be the complete open brain and the spinal cord. This is known as cranioorchiasis. Okay, here the condition which can occur is the spina bifida occulta, the closed asymptomatic neural tube defect in which some of the vertebrae are not completely closed. Sometimes the open brain and lack of skull vault may occur, that is known as anencephaly. Then in encephalocele, there could be the herniation of the meninges and the brain. And in inicephaly, the occipital skull and spinal defects with the extreme retroflexion of the head can occur. Whereas in closed spinal dysraphism, the deficiency of at least two vertebral arches will be occurring, and here it will be covered with the lipoma. Okay, what is lipoma? It is a collection of the fat cells. And in meningocele, there will be the protrusion of the meninges filled with the cerebrospinal fluid through a defect in the skull or spine. And in myelomeningocele, there will be the open spinal cord with a meningeal cyst. What are the types of spina bifida? First one is the spina bifida occulta. It is the mildest form in which the vertebral arches are absent with no involvement of the spinal cord. The only visible sign is a dimple in the skin of the area having a hairy patch. The filum terminale may be tethered to the subcutaneous tissues. This generally happens because of the gap in the bones of the spine. The second type is known as spina bifida with meningocele. It is a bulge in the lumbosacral area consisting of a meningeal sac protruding through the bone defect from the spinal cord and the cerebrospinal fluid. So here again a bone defect might be occurring as in the case of spina bifida occulta, and this time what happens is there will be an increased bulge in the lumbosacral area, and there will be the cerebrospinal fluid which is getting collected in the bulge. The last one is the spina bifida with meningomyocele. It is the condition if the spinal cord or its nerve roots is in the meningeal sac. The larger the cyst and the number of neural structures it contains, the more serious the neurological problem. Okay, so here again what happens, there will be a bone defect, and because of that there will be a bulge, and in the bulge along with the spinal fluid there will be the meninges as well as the spinal cord which is protruding into the bulge, which might be more painful. Coming to the treatment of spina bifida, doctors can operate on the babies when they are just a few days old or even while they are still in the womb. If the baby has meningocele, about 24 to 48 hours after birth, the surgeon will put the membrane around the spinal cord back in place and close the opening. And if the baby has myelomeningocele, the surgeon will put the tissue and spinal cord back inside the baby's body and cover it with the skin. Sometimes the surgeon will also put a hollow tube into the baby's brain called the shunt to keep water from collecting on the brain, called the hydrocephalus. This is also done 24 to 48 hours after the baby's birth. So here we can see the fetoscopic repair, where even before the birth they try to do the repair of the neural tube defect, where they will put the tissue back into the spinal cord and they will try to cover it with the skin. So this is the laparoscopic or fetoscopic repair which will be done. Sometimes the surgery will be done while the baby is still in the womb. Before the 26th week of the pregnancy, the surgeon goes into the mother's womb and sews shut the opening over the baby's spinal cord. Children who have this type of surgery seem to have fewer birth defects, but it is risky to the mother and makes it more likely that the baby will be born too early. After these surgeries, others may be needed to correct the problems with feet, hips, or the spine and to replace the shunt in the brain. As the child grows, the spinal cord stretches and that causes a loss of muscle and bowel or bladder problems. Surgery may be needed to fix that as well. For some people with spina bifida, they might need the crutches, braces, or wheelchairs to move around, and others might need a catheter to help with their bladder issues. Here in the image, we can see an exposed neural tube defect, and the next picture is the protected neural tube and how the surgery is done, where it is placed back and it is covered by the skin. Thank you, students. Hope you understood about the neural tube defects, that is the spina bifida and its